This will be a hard topic to cover in 3 minutes, and I haven't been doing that good with 3 minutes anyway, but October is Breast Cancer Awareness Month, and I don't know that everybody has a story about it, but I have a story about it. And I don't think that you can really confine anything about it to just 1 month, so hopefully this awareness carries on a lot longer than just 1 month a year. Most of my adult friends never met my mother. She died relatively young, and it was just kind of a weird circumstance. But my mom always had surgeries on a regular basis, typical female type things. I never knew what a hysterectomy was when I was a kid, but learned about that one. And so it was not unusual for my mom to go into the hospital every couple of years for something. I remember when I was 15 that she was going into the hospital, and I didn't really think anything of it other than when she left, when my dad was taking her to the hospital and she left, she was crying. And that kind of made me think that this was a little different than any of the others. I didn't really know the full story of what was going on, but kind of quickly learned. My family, I was raised in a really open family that shared a lot of things, and don't take this the wrong way, but the way we lived, it was very common to see my parents naked. We shared bathrooms. We were always getting ready together to go out or whatever, and whenever we vacationed we shared tight quarters. So I would call us an open family. But my mom was going into the hospital for a mastectomy. It had gone through the biopsies and everything, and it was rather severe. At the time, 40 plus years ago, it was a radical mastectomy, which to my understanding is not done much anymore. But a radical mastectomy is probably the worst kind of surgery that you can have. And my mom wanted the family to be aware of what was going on and to know the whole story. So pretty much within a day of the surgery, my mom basically showed the family what was going on and explained everything that had happened and was going on. And essentially the first round was they cut pretty much almost from the elbow all the way up underneath the arm, down around and down the middle of her chest almost to her navel, and remove a lot of muscle tissue in the arm and all the lymph nodes in the arm, along with the breast and pretty much everything else, and then just essentially pull the remainder of the skin over and stitch it back together. That's only the first part of it. As soon as she got out of the hospital, she had radiation and went through a long process of physical therapy. And again, being a family experience, we all had little jobs to do in the recovery. And I remember with radiation that she would actually get burns on her back from where the radiation went all the way through her body and came out her back and severely burned her back. And with physical therapy, with no muscle and no movement and everything being stretched kind of as tight as possible, it was a long road just to get her arm above her head. And then she went through all the normal, I guess, normal things of hair loss and maybe a little loss of self-respect, and it was definitely trying. And as she recovered, there was a lot of other things that had to happen, because without lymph nodes, you can't control the swelling in that portion of your body where there's no lymph nodes. So her rings, wedding rings, had to be reset, and most of her clothes had to be altered to adjust necklines, adjust sleeves, and a few other things. But you know, after a long time, basically got through it, got over it, and other little things where she had to change from driving a stick shift to an automatic, and always having power steering. A lot of little things like that affected life. When I was a sophomore in college, second year in college, one Easter break, Mom called me, or right before Easter break, she called me and said that I should go somewhere for Easter break, spring break, because there was no reason to come home because she was going to be in the hospital. And that turned out to be her second mastectomy. Once it became an issue, she had made the decision that she was going to have a full mastectomy and get it over with and not go through a lot of little surgeries and everything. And she had chemo the second time. You know, that one, unfortunately, I wasn't around much until the summer when school was out, and again, the rehab was kind of going on still at that time. And it was definitely a little tougher the second time through. But again, she managed to survive and managed to cope, and humor was a way for her to deal with it and to cope with it. And her favorite thing was she used to laugh, and she was originally kind of a small-breasted woman, and she admitted it. And she said, "Oh, thank God, now I can be a 38 triple D. I always wanted to have bigger breasts." She never went through with that. She kind of maintained the same size, but you know, you could definitely see the wear and the tear, and just the everyday change in your daily habits and everything. Flash forward to after I graduated from college. The year I graduated from college, my parents were in a car accident, and my mom was in the ICU for a week and never regained consciousness. But at one point, whenever we knew the inevitable, one of the nurses looked at my dad and I and said, "Well, you must have always been prepared for this." And my dad said, "What do you mean?" And kind of realizing that she stepped in it, the nurse said, "Well, from all the surgeries, you must have been prepared for something like this." And my dad looked at me and said, "It never even crossed our mind before," which it never really did. It was, you know, we kind of blindly put our faith in modern medicine and hoped for a cure for whatever it would take to get through it. And then, you know, I guess the odd part about it is that that's not what killed her in the end, that it was something totally unrelated. But you know, she was a survivor, although I don't think anybody coming out of it is a 100% survivor. There's always scars that will remain, whether physical or psychological or whatever it takes. So you know, it's not the happiest story in the world, but the point is that it is something very, very real and very traumatic to go through, I think, from both sides. Probably more so obviously more so for women than men, but you know, if you know someone going through it, they need support, they need understanding, they need help. So, you know, do what you can, and don't limit it to just the month of October. It happens year round. So we'll try and lighten it up a little bit next time. Later.